This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
So this was just kind of a cool case that I saw in one of the emergency medicine journals. So I can imagine this happening and seeing this. I haven't seen it myself, but it was a 6-year-old girl who got her tongue stuck in the opening of a drink lid, a hard plastic, rigid lid, not like a soft one. And her tongue got stuck in there, was stuck for a while. And as things do when they're stuck in a small space, it got more and more edematous. So I think the patient maybe went to urgent care, was seen somewhere else by a provider. They couldn't get it out, so they got sent to the emergency department. Initially, they tried some like viscous lidocaine to numb it up and lubricate it, and still could not. The tongue was just really swollen and stuck on the inside of this drink lid. So they did something kind of clever that I had not thought of. What could you think of that, if you've got something that's mucosal, swollen, big, stuck somewhere it doesn't belong, what could you do to shrink it down?
Sugar.
Yes. So just like we do with rectal prolapses sometimes, they put sugar all over this tongue, waited a while, put more sugar on there, it shrank down a little bit, and they were able to get it out. So kind of little ED MacGyver stuff. If you ever have this situation before you sedate a kid and get really aggressive, something to consider. Thanks.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.